Comprehensive Guide to Slipped Capital Femoral Epiphysis, SCFE. The video is created by Dr. Abhinav Gupta and team. In this video we have covered everything about the topic from initiation to the end. SCFE is a hip disorder that occurs in adolescence, where the femoral head, ball of the hip joint, slips off the neck of the femur at the epiphyseal plate. Etiology: primarily associated with rapid growth during puberty. Influenced by factors like obesity, hormonal changes, and genetic predisposition. Clinical types. 1. Acute SCFE. Sudden and severe onset, often with acute pain and difficulty in walking. 2. Chronic SCFE. Gradual and milder onset of symptoms, may go unnoticed initially. 3. Acute on chronic SCFE. Sudden exacerbation of symptoms in a patient with an existing, undiagnosed SCFE. 4. Pre-slip, early or pre-slipping. Early stage where there is some displacement, but the epiphysis has not completely slipped. Stages and clinical features. 1. Pre-slipping stage. Mild pain in the hip or knee, especially during activities. Minimal deformity or displacement visible on imaging. 2. Acute stage. Sudden and severe hip or knee pain. Limited range of motion and external rotation. Possible leg length discrepancy. 3. Chronic slipping stage. Persistent pain and difficulty in walking. Progressive deformity and altered gait. X-rays show increased displacement of the femoral head. 4. Stage of fixed deformity. Established deformity with permanent changes. Severe pain, limited mobility, and potential joint damage. Early detection and intervention are crucial to prevent complications associated with SCFE. Prompt medical attention is needed if symptoms, such as hip or knee pain, are present, particularly in adolescents during periods of growth. Radiographic assessment for slipped capital femoral epiphysis, SCFE. 1. Early changes. Widening of the growth plate, early signs of displacement. Shear or ice cream cone sign represents initial slip. 2. Late changes. Increased displacement, visible slippage of the femoral head. Deformity, changes in the shape of the femoral head and neck. 3. CT scan. CT scans can provide detailed three-dimensional images, helpful for assessing the extent of slipping and identifying associated complications. Classification of slipping. The classification of slipping is often based on the extent of displacement seen on radiographs. 1. Mild slipping. Displacement is less than 1/3 of the width of the femoral head. 2. Moderate slipping. Displacement is between 1/3 and 1/2 of the width of the femoral head. 3. Severe slipping. Displacement is more than half the width of the femoral head. Accurate classification is crucial for determining appropriate treatment strategies. Mild cases may be managed conservatively, while moderate to severe cases may require surgical intervention to stabilize the hip joint and prevent further slipping. Regular monitoring through imaging, such as X-rays and CT scans, is essential to assess progression, guide treatment decisions, and ensure optimal outcomes for individuals with SCFE. Principles of treatment for slipped capital femoral epiphysis, SCFE. 1. Stabilization. Surgical intervention is often required to stabilize the slipped femoral head and prevent further displacement. 2. Prevention of complications. Early detection and treatment aim to prevent complications such as avascular necrosis and degenerative joint changes. 3. Restoration of normal anatomy. Surgical procedures aim to restore normal anatomy and alignment of the hip joint. 4. Postoperative rehabilitation. Physiotherapy plays a crucial role in rehabilitation post-surgery, focusing on restoring range of motion, strength, and function. 5. Long-term monitoring. Regular follow-ups to monitor growth, development, and any potential issues related to the hip joint. Complications of SCFE. 1. Avascular necrosis, AVN. Insufficient blood supply to the femoral head, leading to bone death. 2. Chondrolysis. Loss of cartilage within the hip joint. 3. Degenerative joint changes. Development of osteoarthritis in the affected hip over time. 4. Leg length discrepancy. A difference in the length of the legs due to the deformity. 5. Functional impairment. Difficulty in walking and decreased range of motion in the hip joint. Physiotherapy management. 1. Early mobilization. Gentle exercises to prevent joint stiffness and promote early recovery. 2. Range of motion exercises. Gradual progression of exercises to restore normal hip joint mobility. 3. Strength training. Targeted exercises to strengthen the muscles around the hip, promoting joint stability. 4. Gait training. Addressing any abnormalities in walking patterns to improve overall mobility. 5. Functional activities. Incorporating activities of daily living to enhance overall functional independence. 6. Pain management. Modalities like heat or ice therapy, as well as manual techniques, to manage pain. 7. Patient education. Guidance on self-management strategies, including home exercises and activity modification. The collaboration between orthopedic specialists and physiotherapists is crucial in providing comprehensive care for individuals with SCFE. Treatment plans are often tailored to the specific needs and stage of the condition for each patient. Vote of thanks. Thank you for watching our video. We hope this information has been valuable to you. If you have any further questions or concerns, please consult our team for personalized advice.